I would like everybody to give a big round of applause for our first speaker of this afternoon. At the crossroads between the present and the future, benvenuti to Professor Giovanni Briganti.
Good day, everyone. Can you hear me correctly? Okay. Well, what an honor to be among you today. If I understand correctly, there are many students from universities in which I teach, the threes that were mentioned, and there are universities, of course, in which I don't teach, and it is my pleasure for the students that come from the other universities for me to be able to meet you. Because the most important point of today's presentation is that we need to talk to each other and we need to work together in order to achieve the adoption of new technologies, not for the sake of the adoption itself, but to improve the quality of care we give to patients and to improve the quality of work that we as doctors do. And it is my pleasure today to talk to you about what is the state of the art in terms of artificial intelligence adoption, especially in this country, our country, Belgium. So, in a nutshell, who is interested in artificial intelligence? By raise of hand. I could stop my talk at this point, because this is the most important point. You, as our future colleagues, should be interested in artificial intelligence because it will become an important part of everybody's life. It is already in the present and will become more so in the future. I want to give with this slide a couple of examples of what AI can do for our health. And please do become interested in these examples as they are already present nowadays in our clinical practice. First, we have monitoring. You know, sometimes we have to follow up patients, and the COVID period showed us that we needed to, follow up patients from a distance because we couldn't in the hospital. There were too many beds that were taken. And however, we could be given the possibility of monitor those patients from a distance and be capable of seeing how they fare from a distance. And when we follow them up, we can discover if they're having an adverse effect or an adverse event that is coming up. And it's especially important with patients that have chronic illness and progressive illness, such as cancer, diabetes, epilepsy, heart conditions, and so on. And such three examples of it, you can monitor heart conditions from a distance using a smartphone and a smartwatch. You can monitor the follow-up of diabetes. Nowadays, diabetes has become the gold standard in the way AI is inputted in the clinical workflow. As for type 1 diabetes, AI is the gold standard treatment nowadays with closed-loop devices that allow us to give type 1 diabetes patients the life they deserve by automatically correcting their glycemia from a distance. And this is really important. AI can help us do it right now. Epilepsy is such a high-burden disease that people carry from childhood, and that is complicated because it carries a high burden, a high stigma. People have epilepsy crisis where they shouldn't, and now we can detect and monitor epilepsy crisis from a distance while also tackling many issues that come with epilepsy. Of course, the highest point in AI is, of course, diagnosis. Radiology is the foremost field in which AI is being developed and adopted from a diagnostic point of view. Who wants to do radiology in the room? Yeah, change specialty. No, I'm kidding, of course. You should follow up your dream to be a radiologist and use AI tools to improve the everyday practice that that is being done. AI tools are commonly widespread in radiology, but also radiology is giving us the example that some things are not going right with artificial intelligence, and that we should follow up with more and more clinical research. Pathology, laboratory medicine, dermatology are all fields in which diagnosis and in which images and data are very, very important. Quantitative data are really important. And these fields can be rapidly adopted through artificial intelligence to improve the quality of care. Now, for dermatology, there is a bit of a problem, is that if you give everybody, every citizen, an app, such as that one, that allows you to scan your lesion and have a differential diagnosis, we will have our emergency room filled with patients that will be scared of having cancer, because cancer is, of course, everybody in everybody's differential diagnosis when we have lesions. Well, this carries an important example as to what is the role of medical doctors in the development of artificial intelligence tools and their delivery across the population. We can predict, as I said, adverse events. Who thinks that in Belgium we are really good at prevention? By raise of hands. And of course, this is the only questions on which everybody always agrees in my audiences, is that we in Belgium are not really good at prevention. But of course, nobody is right now. Why? Because we lack the finances, we lack the funds to carry out good prevention strategies. And why? One of the most important bottlenecks of prevention is the first line. And as long as we do not have sufficient general practitioners, and as long as our general practitioners, who wants to do GP? By raise of hands. My people, we need more vocations in general practice. We do need it. As long as our GPs are too filled up with severe cases, we cannot carry out prevention. Clinical intelligence is a big topic. Who has heard of clinical intelligence? It is about rooms, such as at the emergency room, that are fully equipped with devices that can help us transcribe what is happening with the voice of the doctor, with the voice of the patient, and also carry out recommendation based on the patient's and the doctor's conversation. Who has used LLMs, and in particular ChatGPT, Gemini, Bard? Raise of hands. Not enough honest people in the room. Well, of course, LLMs have taken us by storm into offering us tools for the every citizen to use in current day. And now, I have, of course, some of my students have used these tools to give me works. And of course, I don't know if it is a smart thing to give up work written with ChatGPT to an artificial intelligence professor, because of course I can spot them, but it can and should ease us into many of our tasks, and in our clinical role we have much writing to do, and yeah, LLMs can help us. Okay, we can advance. Now you can ask yourself, where are we in Belgium? What can we do to improve the artificial intelligence adoption in Belgium? Well, you should know that Belgium is one of the only countries in the world that has adopted a national artificial intelligence plan. We are pretty good at it. In fact, we have a specific part of our national AI plan that is specifically targeted to health. And in health, we have 5 main objectives. And since 2020, I've had the pleasure to direct our efforts on the federal level at AI for Health. This is why this is the title of the presentation, to coordinate the efforts that we do in Belgium. The first objective is to make the population healthier and improve quality of care. Of course, we need AI to improve the way we care for patients. We need to use AI to augment the skills and the quality of life of healthcare professionals, and let them also, live a better life while they work. And, well, you know that we as doctors, we spend a lot of our life at work. Well, if you do not know yet, you will very soon. the third part is to support healthcare organizations. That is, to support the way our hospitals strive. And we do know that many of our hospitals are in a financial crisis, that many of our hospitals struggle to live on and to carry out many of the objectives they should be set up to. And supporting healthcare organization is a thing that AI can do very well by managing the workflows, by managing the people, by managing the finances, and even the operating rooms. So as when the surgeon is a bit late to his scheduled surgery, well, we can plan something to plan up ahead using automated algorithms. The fourth objective, and this is really important to me, is to stimulate research and development. We can use AI to generate thousands of research hypotheses in a matter of seconds. We can use AI to develop new medications, to repurpose old medication. And we can use AI to drive public health policies. Who thinks that we could have used AI in part to solve the COVID crisis? Who thinks that? By raise of hands. Could we have used AI to solve or to manage better the COVID-19 crisis? Not many of you. That's interesting. Okay, we can move on. We were the first country to carry out a national survey, both with specialist doctors and with generalist doctors, in order to understand what are the fears, what are the challenges, what is the vision of the adoption of AI. And we did this with AI for Belgium, the federal coalition in which I contribute, with the help of RMN, that is the press that you receive, and of course the Specialist Medisphère, that are the journals that you will read once you will have access to them. And we carried out the first national inquiry of how we can adopt AI in the clinical care. And what can we discover? Well, most clinicians after the COVID crisis are positive to the adoption of artificial intelligence, which was something that the first time I talked about AI, I wasn't prepared for. Such a positive feedback from clinicians. This is really good. We saw that 90+% of respondents believe in the positive impacts of AI, and believe in the positive impacts of AI when it comes to the improvement of clinical care, when it comes to personalized care, and when it comes to reduce the amount of time we pass filling documents and low added value tasks. We didn't do medicine to fill up paperwork. We did medicine to treat patients and to see them. And of course, AI can help with that. What we see, however, is that when we did this survey in 2022, that the main problem was that many people, many doctors thought that AI is going to dehumanize care. Now, I want to ask you, as my future colleagues, do you think that we will use artificial intelligence to dehumanize care? By raise of hands, who thinks that we are going to dehumanize care? We are going to dehumanize care. So healthcare will be less human with artificial intelligence. This is the question that I'm asking. Okay, I will be interested to get your opinions on why you think there will be less human as a doctor when we will use AI. If I've made myself clear, and I'm starting to fear that I wasn't, is that AI will help us rehumanize care, but of course it is not the only point in which we have to work. We can move up. Now, what you should know is that Belgium is a really, really good country to do artificial intelligence in. We have 11 million people in this country, but we have one of the strongest substrate for artificial intelligence. We have hospitals, and we are standing next to one, that are champions of clinical research. We have a strong pharmaceutical industry substrate, and pharma is going to be an important part of the artificial intelligence innovation. You will see. I'm going to talk about it a bit afterwards. We have, for a little country of 11 million people at the center of Europe, we have more than 300 companies that do artificial intelligence or medical technologies. This is a lot compared to other countries. We have at every level, federal, regional level, we have things, structures, organization, people that deal with the adoption of artificial intelligence. And this is a really important thing to consider, is that artificial intelligence is an important thing for our political systems. We have coalitions that at every level, there are determined people that are working to improve the adoption of artificial intelligence in our country. Now, we do have, if we can move, thanks. Yeah, we do have some problems though. And I want to talk to you about these problems today, because as my future colleagues, you will be directly implicated into this part. Our hospitals have a disease. I call it the hospital paralysis. They strive and they struggle to improve because they lack funds. How many of you have already worked as an intern in a hospital? Okay. How many of you have heard that the hospital you worked in was in a financial crisis? My people, we do not give you the right impression of our hospitals. Because the crisis is so clearly visible, many things cannot be done. And as we lose funds, we lose competitivity. As we lose competitivity, we lose healthcare professionals that prefer to go work elsewhere, even in other countries. And as we lose healthcare professionals, well, things start to get less interesting for our healthcare system. There is a thing that nobody talks about, is how we are also hemorrhaging IT professionals in hospitals. And as we have low IT professionals, informatic professionals, we cannot carry out innovative projects, well, such as artificial intelligence. But we have more patients, more complexity, more chronic illness, and more tasks to do. And as a clinician in the field, you will feel that the ground is shaking beneath you when you will start to work. And it will be our collective role to help our own structures to raise up and to face the future. You should also know that I'm not always proud about the way we develop AI in healthcare. AI is currently driven by companies that are submitted to our capitalistic system. And because of such, well, the way we develop AI is that we collect data, we train the algorithm that will help us heal patients, but we do it on a small sample that a hospital was kind enough to give to the company. And afterwards, and every professional that works in clinical research will tell you, you cannot stop in healthcare with testing the solution on your own data. You need to call a colleague from a different hospital, collect another sample, and see if your problem, your solution works on the new sample. If you work in Antwerp and you want to test a model, you cannot test it on people that come from your own hospital. You need to come to Brussels. You need to come to Liège. You need to come to Mons. And this is why university competitions do not work for artificial intelligence. We need to stop fighting each other just because we come from different universities, just because we come from a different philosophical contributions, just because we come from a different background. In artificial intelligence, we either go big together or we go home. This is another problem that I want to talk to you about today. Our hospitals urgently lack competencies in evaluating the softwares that they are adopting from a clinical point of view. This means that sometimes solutions that have not had any clinical validation through clinical studies are being used to treat patients in real life, in routine care. It is like if you developed a new medication and you gave it to patients without a clinical trial first. This is really severe. And why is that? Because we lack medical students that study artificial intelligence and that know how it is done. And this is why in now 3 universities, ULB, UMons, ULiège, we have started to do artificial intelligence course. I hear that UC Louvain is also started to doing it. And this is good because your generation needs to have a formal AI education so we can avoid this problem. Moving forward, as a medical student, I often heard that pharma was the bad guy. And who has heard the same thing in the room? And you should stay away from pharma, and if you go talk to someone from pharma, you become a very, very bad person. Now, you should know the truth. The pharmaceutical industry is giving a lot of funds to Belgian hospitals to carry out artificial intelligence projects. And I do not know how far we would be if the whole sector, that also includes pharma, wasn't there to help us. This is a moment in which we all need to work together, and we cannot exclude a sector just because we have a prior negative point of view against them. We need to test them, we need to work in a transparent way, we need to disclose conflicts of interest, and we need to work together to achieve better outcomes. And we should include everybody in the healthcare system. This includes also pharma, but also technological companies, also other companies as well. You may have understood that we are missing one piece in the puzzle, and this piece is preventing us to move fast and move forward together. Of course, one of the biggest pieces is you. We need more medical doctors that are convinced that we need to improve care, also using technological innovation. Well, you will ask yourself, what is the government up to with artificial intelligence? Well, apart from our national initiatives, the government is also putting a lot of money on the table in order to improve the way that hospitals deal with artificial intelligence. And the government in the past 2 years has put out 2 major calls for projects that will finance hospitals if they do AI innovation. And this is good, but we are missing 3 ingredients in Belgium. You cannot prescribe a technology to a patient if it isn't reimbursed. This is the first point. Reimbursement is a really difficult point to deal with right now. Why? Because we do not have the funds in Belgium to reimburse digital health technologies. Reimbursement will be one of the most important priorities in order to achieve healthcare innovation. The second is validation. As I've mentioned you, we do not have enough clinical trials for digital healthcare tools. We need to improve the way, but we cannot do it if the medical doctors that work in hospitals are not convinced that we should test these solutions, are not convinced that medical doctors play an important role into doing clinical trials and clinical studies that test the value of course, digital healthcare technologies. And we should regulate more, and the AI Act gives us a new legislation. Who has heard of the Artificial Intelligence Act? Very few of you. The Artificial Intelligence Act is a new law that is like the GDPR, a European regulation that will come into your life, and you will certainly hear about it as a medical doctor in 2 to 3 years. These are my conclusions for the day. The first is that the Belgian ecosystem, us, together, not only one actor in particular, not only hospitals, not only pharma, not only government, not only academics, are solving the artificial intelligence challenges one by one. We have such a strong ecosystem in Belgium. It makes me happy to be a part of it. And now you should enter it as well as active contributors. The second point is that clinical adoption of artificial intelligence will improve if we care for you. If we take care of your perceptions, of your wills, of your desires when it comes to the future of your own profession, we will be able to answer it. But if we do not listen to you, if we do not listen to the young people, we will not get far. And third is that everybody's efforts are needed in order to get there. If we want to achieve the new revolution of healthcare, if we want to achieve better working conditions for everybody, if we want to achieve better accessibility, better care, but also better quality of life for us, the clinicians, we need to work together. And this is where you come in. When I was at your place, not many years ago, just a couple of years ago, I heard that well, medical doctors do not have their place in artificial intelligence. And if they do, if they get interested with artificial intelligence, they get interested with innovations, they get interested in projects, they will not be good clinicians. These are comments that come from mediocre people. You should get involved because this is your future. You should get involved in artificial intelligence. You should get involved in the new healthcare. You should get involved into improving your own work conditions. That is the minimum, and we need to listen to you. Thank you very much.
Hello? Can you hear me?
Not correctly, no. But I hear you, of course. But I don't think that the others hear you yet.
Can you hear me now?
Shout better! No, we cannot hear you yet.
To talk louder? Yeah. This way?
Yeah.
Okay.
Yeah.
So you said at the beginning of your presentation
Yes.
that 3 universities, ULB, UMons, and ULiège,
Yes.
are building AI classes.
Yeah.
That's what you said?
It is already the case.
Yes.
It is already the case in the Université de Bruxelles. It is the case at University of Mons with the chair of artificial intelligence and digital medicine that you see on screen. And it is the case, it will be the case starting September 2025 at University of Liège. And I heard that Université Catholique de Louvain is also doing that class right now.
So my question was, a lot of teachers agree on the fact that AI is not 100% correct, so it may contain a lot of error. So what is your opinion about AI classes? Because it's not 100% accurate, you know. So that's why I'm asking this question, because AI is not 100% true, but we're talking about classes to medical students, and if the AI contains mistakes, how the students are going to learn, you know, efficiently.
That is a really interesting question. Did everybody hear the question? Okay, now I do psychiatry. And who wants to do psychiatry, by the way? Choose psychiatry! That's a really important thing. So we do teach people that antidepressants, are the treatment for depression, right? And antidepressants work 60% of the time. You have a 60% chance when you give an antidepressant to a person that it will respond to it. Now, most AI models that are on the market have a 90% accuracy. So in terms of accuracy, what is found on the market right now is more impactful from a clinical accuracy precision than antidepressants. Now, that is the first argument I want to give, is that of course AI are imprescribed, but AI is a tool, is a set of models that you develop using statistical techniques. And this is what I teach my students, that afterwards you need to critique them. The problem comes not from the artificial intelligence. It comes from the people that do not know how to use it. And therefore, when you have the output of a model and you aren't capable of doing the critique of that model, of knowing when and how it can be wrong, well, it is the human's fault, not the artificial intelligence. Now, the problem is with the term AI, we are under the impression that we are under a kind of superhuman being that is helping us do things. That is clearly the case when I'm cooking and Alexa tells me that I'm missing my pasta is gonna be all soft because and it shouldn't be as different, and it should be integrated. And this is what we do at Université de Bruxelles. We integrate it into statistical practice, statistical analysis, medical informatics, and research questions. Why? Because we need a critical thinking about artificial intelligence. But it can be really precise. It can also make mistakes. It all depends on who is training it.
Last question, and it's not about the accuracy. What about the human part of teaching? Because AI and a human teacher, it's not the same feeling for students, you know? Because I like my teacher who makes, mistakes, jokes, who talk about his day. And what about a technology who has 90% of accuracy, unless than a teacher who has only 60% accuracy? But what about this feeling that we lost with AI classes?
No, so when I'm talking about AI classes, I'm talking about classes that teach about AI to medical students. Yeah. Now I understand your question. Now, well, I think most of my students will be happy not to see me anymore. So maybe AI will be a better teacher than I am. Now, apart from that, for many topics, AI can be an excellent teacher also. I do think that in many fields of medicine, given the proper training, and I do not think that nowadays we do have strong enough systems to do that. But with enough training, AI systems could be great tutors, not teachers, but a kind of companion that a student can take home. But yeah, the classes that we have are classes that teaches AI as a method to students.
Okay, now I understand. Thank you for your answer.
Yeah, so actually it's indeed pretty interesting. Before going to the next question, as you were mentioning, having an AI replacing a human, teaching other humans, some Chinese hospitals have been using since 2018 Xiao Yi, who is an AI doctor, in order to do the assessment of the patient when the patient arrives at the hospital. What's your opinion on that? Do you think it's going to arrive some days here in Europe as well?
I think it will all depend on them and on us. What are the level of humanity that we want to be left in medicine? To what extent do we think that what we do as human doctors matters, but not in general, task specific? I do not think that my time should be filled with filling administrative papers and to fill up prescription and to fill up certificates and to fill up papers to let somebody know that my patient came to the hospital to see me. So there are some times, and many studies show that administrative time is 60 to 80% of a medical doctor's work. Only the rest of time is direct clinical tasks, and this is a lot. So I think that we need to take care of AI with all the administrative part of the work, and then we should be left with the humanity, and this will be our role collectively, is how human do we want to be kept? How human should our healthcare be? I think that it should be more human than it is today. And for it to stay true, we need new technologies to take care of all that is inhuman in today's work. Because nowadays I'm not convinced that healthcare is very human.
AI as not a replacement to the human, but as a tool for the human.
AI for the doctor, AI for the healthcare professional, AI for healthcare, for hospitals, and never instead. Yeah.
Your question? We would need a robot.
Hello, and thank you for your talk. So a lot of our teachers, I'm from Romania, and a lot of our teachers are saying us the following thing, but I want to ask that given the fact that you are more in the middle of the situation and you have more knowledge about this field of AI, if you can comment if radiology will be the first specialty that will disappear given the AI improvement and everything that is happening.
What happened, and I think this is an interesting comment and an interesting question. What happened is that for a lot of time, radiologists really feared artificial intelligence because the press, the media, was telling them that algorithms were as good, if not better, than radiologists at diagnosis. Can we look at it for a minute? Now we have some studies, and radiology has a lot of studies, in which data is collected in a hospital, right? The algorithm is trained on the data that comes from that hospital. And then the model is tested on the data from that hospital. And they test the accuracy of it. Of course, AI can become really good on the data that it knows. But the more good it becomes on the data that it knows, the less good it becomes on data that it doesn't know. So what happens is that radiology is currently undergoing a replication crisis in artificial intelligence. That is, that we cannot replicate radiology studies from one sample to another sample. Now, we have 2 towns in Belgium. I come from one of the 2. It's called La Louvière. Does anybody know La Louvière? Yeah. It's a really good town. I love it. That's my town. And La Louvière is a kind of underprivileged city, right? Many people struggle with financial issues. It has got some social issues as a town. But the people are really good and really warm. And then you have Uccle. Does anybody know Uccle? So as you come from Romania, I should let you know that Uccle is a kind of town. It's a special one. People do not have the same financial issues that come in La Louvière, but they have other issues there. And when you develop an algorithm in La Louvière, it will not work in Uccle, especially on radiology patients. And sometimes, if you shift 20 kilometers away, a radiology algorithm will not work anymore. You will drop from 98% of accuracy to 68%. This is what happened with a Belgian study that was carried out a couple of years ago. So I do not think that radiologists are going to disappear. And the radiologists that are nowadays adopting AI are surely going on in really crazy cars, because they have understood that artificial intelligence is a tool to them. And thanks to artificial intelligence, they can work really fast. And most of all, when the emergency doctor calls them at 4 a.m. to analyze a picture, they will have an algorithm that will help them stay clear when their mind is clearly not. Because AI can support the human factor of our own work. So no, the radiologists are not going to disappear. Many people that work in hospitals, that direct hospitals, that manage hospitals are thinking that they can replace doctors with radiologists. But people that think that you can use AI to replace humans in medicine do not know anything about AI and do not know anything about medicine.
So, ladies and gentlemen, we unfortunately have to stop the Q&A right now. But Professor Briganti is staying with us this afternoon, I hope. Not at all.
I do not know, but yeah, please do. I didn't know that, but you can contact me definitely. And if you want to start a research project surrounding AI, we have many projects going around that is work for everybody. And if you are interested in choosing AI as part of your future career, do not hesitate to contact me.
So LinkedIn?
LinkedIn, email, whatever works. And if you're in my own university, well, you can spam me on Teams. Yeah.
Ladies and gentlemen, please give a big round of applause for Professor Briganti. Grazie.